Next up, we have our latest update on vaping with Dr. Scott Bickle and Dr. Stanley Lee. Dr. Scott Bickle is a pediatric pulmonologist with the Norton Children's Medical Group and is Associate Professor of Pediatrics at the University of Louisville School of Medicine. He is also the Associate Fellowship Director for the Division of Pediatric Pulmonology. Dr. Bickle received his medical degree from the University of Louisville. He stayed in Louisville to complete his pediatric residency, then became the first pediatric pulmonology fellow at the University of Louisville. Upon completion of his fellowship, Dr. Bickle joined the faculty at the University of Louisville as part of the Division of Pediatric Pulmonology. Dr. Bickle enjoys caring for children and their families at the Novak Center for Children's Health, Norton Children's Hospital, Home of the Innocents, and at the Fraser Rehabilitation Institute. Dr. Bickle has special interest in pulmonary function testing, medical education, and the optimization of asthma care. As such, Dr. Bickle is an active member of the Norton Children's Hospital Asthma Task Force. He is involved with multiple ongoing research projects, including NIH-funded grants. Dr. Bickle has multiple publications in peer-reviewed journals on the clinical applications of impulse oscillometry, the pediatric medical education, and barriers to adherence in asthma. In addition, he has presented at international conferences and has lectured to a wide array of local and regional groups. Dr. Stanley Lee is a pediatric pulmonology fellow with the University of Louisville School of Medicine. He finished his pediatrics residency at the State University of New York Downstate Medical Center in Brooklyn, New York. Dr. Lee's clinical interests include e-cigarette and vaping, the product use associated lung injury, or EVALI, pulmonary hypertension, asthma, population disparities, infant safe sleep, and sleep medicine. He was recently published in a peer-reviewed journal about spirometry and radiographic findings in EVALI. Take it away, guys. Thank you.
Oh, all right. Thank you so much for that very nice introduction, Dr. Jennings. We really appreciate the opportunity to present today. I'm going to try and share our screen here, and hopefully everyone can see this. Just let us know if not. So a year ago, we were very interested in a rapidly rising epidemic of lung injuries in teenagers and young adults, ultimately linked to vaping. Now, of course, we're dealing with lung injury due to COVID, and so I think it's important to discuss both of these topics here and appreciate the opportunity to do so. I'm going to hand it off to our pulmonary fellow, Dr. Lee, who has a special interest in this area. And I'll rejoin a little bit later. There's my Twitter handle. They're encouraging Twitter use here to as a way to reach out and extend our footprint. And so certainly feel free to follow me. Here is Dr. Lee. Thank you very much.
Hey everybody, thank you Dr. Bickle for the introduction. We have no relevant disclosures to disclose, and for this talk, review the history of vaping and e-cigarette use to discuss acute and chronic manifestations of lung injury, and then I think more importantly at the end of the talk, Dr. Bickle is going to touch base on the overlap or the potential overlap between EVALI and COVID, and then we'll talk about public health interventions and regulations as well. I've only been doing pulmonary specifically only for a year and a bit, but vaping has been an interest of mine because it kind of fortuitously fell into my lap when the epidemic happened and we didn't know, so I just kind of took it on, and I've been successful in doing a couple of things with it. So, so to begin, what is vaping? So vaping is just, for starters, an act of inhaling and exhaling an aerosol when it's heated up to high temperature, often referred to inaccurately as a vapor, and it's produced by an e-cigarette or similar device. It usually contains THC or nicotine. So this picture below is the THC pen. And we'll talk about how it kind of works. An e-cigarette works that there is on the top left of this, not the top left, on the right part of the screen, that's where the liquid is in the cartridge. So it holds the nicotine, and then when the user inhales, the sensor detects the inhalation and it automatically heats up this atomizer device in which it vaporizes the oil, and the oil from liquid, it becomes a gas in which we are able to inhale it in our lungs. And then when the temperature in our lungs obviously isn't as hot as in the vaporizer, it precipitates and deposits in our lungs, and it has that THC or nicotine effect, and also some side effects associated with it that cause EVALI. Brief history of vaping. I'm not going to spend too much time on this, but in 1930, Joseph Robinson made the first patent, and in 1963, Herbert Gilbert made the first device that resembled the modern e-cigarette. And 2003 is kind of when the game changer was. Han Lick, a smoker and a pharmacist from Beijing in China, makes the first commercially available e-cigarette after his father, a heavy smoker, dies of lung cancer. So a lot of things came from China, and this included vaping. And then, that kind of snowballed, and a bunch of e-cigarettes were made available in Europe and America, and the FDA issued a statement on regulating e-cigarettes in 2016. These are the quote-unquote pioneers of vaping, Mr. Robinson with the patent, and Mr. Han Lick, who designed the first commercially available one. So basically, what's in a vapor? The vapor contains volatile organic compounds, nicotine, and the THC that the users like to inhale. And associated with that, there's heavy metals and cancer-causing chemicals. And more importantly, what we think and what we suspect is causing the EVALI at this point are the different types of flavorings. So, of course, nicotine, THC, and these are like the flavorings on the side. I know diacetyl. Historically has known to be caused like popcorn lung, and now this new vitamin E acetate, we'll touch on later, was purported as the culprit to a lot of these injuries. So what's in a name? I mean, they call it different things. ENDS was kind of a more historic name for the e-cigarettes. And then you got the mods, the tank. Juul is the brand, of course, and banking is like the big machine that people inject vape juice, dab pens, and one interesting thing is this other way that they've described is called dabbing, which is heating up like THC resin, which is really solid. It's a crystal instead of a liquid in the THC vaping oil. But then when you heat it up through a glass device kind of like this at a very high temperature, the resin vaporizes and you can inhale it in your lungs. And that's kind of how people get high. This is majorly THC versus, and there's not a lot of users that use nicotine for this. So, I mean, e-cigarettes are very ubiquitous now. On the top left corner, there's a Pinterest, image on the girl using her hoodie to vape. It's on cell phones, on Apple Watches, and backpacks. It's on albuterol inhalers, for crying out loud. It resembles that, and I think that's so ironic. But then the argument goes: is it vaping safer than traditional smoking? We know that smoking is linked to lung cancer and other obviously comorbid diseases, but it's not currently approved for smoking cessation, and they carry, as we know, their own unique and potentially serious health consequences. Smokers use both, and then they find that it's a potential gateway to smoking, or vice versa for those that don't already. So interestingly, throughout the years, the use of marijuana products has evolved. And recently, majority of the patients diagnosed with and hospitalized with EVALI endorsed vaping THC and then plus minus nicotine. I think just THC alone is like 80%, and THC plus minus nicotine would be like go up to upwards of 90%. And just gone are the days of the counterculture in which smoking marijuana in groups with the comment, passing around a joint, which is just a cigarette with marijuana in it, and all these different mechanisms of smoking publicly. But now, the Gen Z generation, the kids, use a more discreet e-cigarette where you can smoke at the comfort of your home without getting caught by your parents. Because it's not going to, everyone knows what the smell of THC or marijuana smells like, and that's going to be easily caught. So these kids try to outsmart their parents and, smoke subtly in their rooms. And in the hopes that their parents don't find out. So it's very popular with the children and the adolescents, more of the adolescents this year. I've kind of had patients from at least as young as 12, and pediatrics we cut off at 21. So we've seen kids up to 21. Majority of the kids are at least like 15, 16, 17, 18, either grade 11 to like second year college. As you can see in this picture, the left picture shows the groups smoking, having a good time in the 70s or 80s. I don't know what that is. And then the right is what's happening now. And this is unfortunately the reality of what's happening in our community these days. And what's more, as a pediatrician, this breaks my heart because I watched Cartoon Network when I was a kid and Nickelodeon, and they promote Juul, which is bizarre. And it's just, I don't know if there is any place for this in television, but then they advertise these vape juices that resemble like sodas and candy, like Sour Patch Kids vaping. Like they've manufactured these flavorings so well that, and I think that's the catch. It tastes good, it has nicotine, and it has THC. Oh, the kids are all gonna buy it. And this graph needs no introduction. I think as long as everyone hasn't been living under a rock for the past couple of years, we know that the incidence of vaping has increased pretty significantly. And because of the reasons I mentioned earlier, it's very popular, especially in high school students. And I knew that talking to the patients anecdotally, they were just saying, yeah, we were in high school, we just vaped during recess and lunch. And I was in high school, I didn't even know vaping existed. And, there's a bunch of different adverse health effects from vaping, acute lung injury, inhalation injury, hypersensitivity, pneumonitis, all the differentials, DAH, ARDS, bronchitis obliterans, eosinophilic pneumonia, and there's non-pulmonary issues. It's just beyond the scope of our talks. We will limited amount of time with like increased risk of MIs, platelet dysfunctions associated with seizures, and thermal injuries. I think that's very important to note as well because these e-cigarettes are heated to a very high temperature. So I think this is kind of the landmark paper of EVALI, which is an article in the New England Journal, initially published around August of 2019 from the hospital in Wisconsin, and again, the group in Illinois. So a lot of the kids in Illinois and Wisconsin were studied, not kids, I think they're adolescents, and then they confirmed that there was a bunch of vaping-related deaths. And then, the amount has gone up to like, I think 2,800 the last time I checked. And then the CDC stopped counting because the incidence has gone so low in March, I believe. And in November, there was another article, another landmark article, which I'll discuss later, identifying vitamin E as a potential culprit that led to the vaping injury. And as you can see here, this is really interesting. 2,800 hospitalized, not deaths. I correct myself. And only 68 people passed away from vaping. So basically, this spike's really interesting because this spike has never really been present anywhere in history. Contrary to like coronavirus and the other this big worldwide pandemic, interestingly about EVALI is it only happened in America. I don't know if there are any reports north of the border in Canada, south of the border in Mexico, European countries, and Australia. This has not really, manifested, and predominantly it's in America, suggesting that there is something fishy. There is something that, was it a bad product that got marketed in America and bought in America versus like a worldwide pandemic that everyone right now is facing? It is very different in etiology. and the pathology, and that's what's really interesting about vaping. And here, just for data, I'm not going to try to bore you all with all of the numbers, but I think interestingly, for THC-containing products, 78% of the patients acquired these products from informal sources. So some kids have their drug dealers, and their friends, and we have no way of regulating them, especially in Kentucky, where THC is not legal, compared to the other states in which marijuana is recreationally legal. There is still a wide variety of obtaining these cartridges. And interestingly, anecdotally again, a lot of the teenagers told me, well, after they got intubated and extubated, and I saw them in clinic, and they told me everything. It was cheaper. It was $20, $15 cheaper, and we're in high school. We don't have money, so we ended up buying the cheaper product, and that's what landed in the ED. Not scientific at all. It's just from stories that they've told me. And similarly, nicotine is 69% from commercial sources. I think nicotine is more widely available in the gas stations, and I don't know if grocery stores sell e-cigarettes or something. I don't really ask for them, but it's so more commercially available than THC, which is still qualified as a drug. So as you can see, that's fairly obvious. EVALI in Kentucky, there were 57 cases. I think there are more now, because since I got here, I think we got a couple more, right, Scott?
Yeah.
There are more confirmed, but I think the CDC and the health agencies throughout the country have stopped because incidence is so low. And there were 10 confirmed and 12 probable cases, with one death that's also probable cases as well. And this is a definition of EVALI. There's a confirmed case on the left and the probable case on the right. Everything's the same except for probable. In a confirmed case, there's no other reason their medical history. No infectious disease test that is positive, or RPP or respiratory panel that's positive, or anything else. There's a probable case there is. So basically, presenting symptoms of EVALI is subacute with deterioration. I think a lot of the kids that present with chest tightness, a lot of weight loss, and non-specific fever, back pain, neck pain, and they don't really know what's causing it. They come in when they're either so sick from the generalized malaise or respiratory distress, and as any ED provider would do, something as mysterious as bilateral chest X-ray findings would show. Would warrant $1 million workup. So 98% respiratory symptoms, 81% GI, and 100% constitutional symptoms with 40% headaches. Interestingly, now moving forward, how do we treat EVALI? I think the mainstay of treatment is corticosteroids, so to decrease inflammation in general. However, it's still unclear whether the discontinuation of the offending agent, which is the vaping, or increased respiratory support had a bigger contribution to the respiratory resolution of symptoms over steroids. But we use steroids because I've personally seen the age-old debate is pulse steroids versus oral steroids with a long taper, with or without. So there hasn't really been much evidence with that yet, just because of the smaller number of cases. And this is a nice table going over the evaluation of and treatment of EVALI. Certainly children that have worse disease warrant further investigation with bronchoscopies, BAL, intubation, and whatnot. Whereas kids that just have mild disease, as we treat just supplementary oxygen, room air, and discontinuing of the offending agent. I actually was able to do a couple of articles, a couple of projects with it, and I looked at spirometry at follow-up. And I don't want to bore you with numbers, but just for FEV1 and FVC of these children that we followed, the mean FEV1 on the middle went up from 76.3 up to 102.4, and the FVC also went up from 80 to 108. I mean, this is very obvious. If you discontinue vaping and give them steroids, that they'd recover. But it's really nice to delineate this as to add to the current knowledge of science. And I got another publication on radiographic findings in EVALI. We compared children that were admitted in the hospital, their radiographic findings, chest X-ray and CT, and repeated it 3 months after. Chest X-ray shows up bilateral diffuse infiltrates. Bilateral pneumonia is not very common in children, so bilateral infiltrates like this should raise a suspicion, especially in a teenager, that we can't really trust a teenager these days, have to do that. And then so we just moving forward, we find that the radiographic findings were improved as well. And for the sake of time, I'll go over a couple of quick images, and this is in B would be the initial CT, and we saw that there's resolution of the CT findings in the image D. You can see in B and D, C and D as well. C was the initial incident, and then D was when they recovered. And then this is the role of vitamin E acetate. This is another landmark article, just to end my talk a little bit early because we're running out of time and Dr. Bickle still has to talk. But 94% of the patients with vitamin E acetate positive in the BALN patients with EVALI versus 0 without. And so, I think there's a big social stigma on vaping and nicotine and THC, and it's important for us providers to establish rapport and trust with the patients. They'll tell us everything if we have enough built trust with them. It's important to know what they are vaping. It certainly differentiates THC versus nicotine and whatnot, and use that to stop them. These are the marijuana laws in the country. We know that there's a lot of states in dark green that are legalized. Arizona just flipped. And in north of the border, like, this is something that we have to be cognizant about and address, because in Canada it's legal. So I'm gonna pass it along to Dr. Bickle, but thank you for having me. And Dr. Bickle's gonna talk about COVID.
And then your page. Yeah, thank you so much, Stan, for that. I really appreciate your input, and the research you've done there is quite impressive and contributing to our division. So I do want to discuss is Dr. Lee talked about, the presenting symptoms of EVALI are oftentimes GI in nature initially. They can be gradual onset. And then when you look at the symptoms of COVID, there's a lot of similarities. You have somewhat non-specific constitutional symptoms. You can have shortness of breath, cough, fatigue, and there's a lot of overlap there with EVALI. There's also a lot of overlap in the radiographic findings. As Dr. Lee mentioned, there's a variety of findings you can see on chest CT. Typically, the findings for EVALI tend to be a little bit more centralized in nature, whereas COVID chest CTs may, in some instances, have more peripheral findings, but the overall manifestations overlap quite significantly. It'd be difficult to distinguish one versus the other solely on imaging. And so you've got to really look at your history and certainly your testing. I think it's important to note that, teenagers and young adults who are vaping might be at more risk for a more severe manifestation of COVID. And so you might have overlap between these two syndromes. And in fact, there has been some very good data that came out this past year looking longitudinally at initially healthy adults and showing that the use of e-cigarettes in and of itself is an independent risk factor for respiratory disease, as of course is tobacco smoking. But dual use, using both, is riskier than using any product individually. And so a lot of these patients are at quite high risk. And there was data that came out, it was published in August, but it was based on data in May. And I think the important take home here is if you remember the testing situation in May for COVID, we weren't testing as widespread as we probably are today. And so at that time, it was reported that vaping was associated with a 5-time higher risk of COVID, and that the combination of the two, vaping and smoking, gave you a 7 times higher risk of infection. And it might not be that, that these patients were actually acquiring the infection at a higher rate, but that the manifestations were more severe and so that they were being picked up upon. The other thing to keep in mind is, there's lots of evidence that drug, alcohol use have been on the rise during the pandemic. Children in many situations are out of school. There's lots of evidence that there are very negative manifestations on mental health. and that can lead to increased use of drugs, alcohol, vaping, THC, and so on. And so it's really important to be screening our patients for this. There are quit lines in Kentucky. So, once you identify the issue and treat the acute manifestations, you really have to be able to address going forward how to get them off of the product that they're using. And so these quit lines are one resource, and we're working on developing other resources as well. So I want to thank everybody for their attention. I think that, the take-home points is that really adolescents and non-smoking adults should not be using e-cigarettes. They're not designed as a cessation tool. They have their own, very negative health manifestations. Providers need to have a high index of suspicion for EVALI, especially in the age of COVID. And there's public health interventions, so flavor bans and things like that that are essential for decreasing the rates of EVALI with time. And so with that, again, I appreciate everyone's time and attention, and we'd be happy to take any questions.